Welcome everyone to our webinar. I'm Dr. Jody Jacobson-Fry. I'm the co-chair of the Workplace Suicide Prevention and Postvention Committee with Dr. Sally Spencer-Thomas. I'm excited to be here with you today to talk about a very important topic, pilot peer support, using that to reduce barriers in suicide prevention. Our guest presenter today is Charlie Curreri. He is currently an American Airlines Airbus 320 captain and retired Air Force, combat decorated F-16 pilot. Charlie has a master's in human relations from the University of Oklahoma and a master's in counseling from Colorado Christian University. He's in the dissertation phase of his PhD in industrial organizational psychology at Grand Canyon University. Charlie developed and implemented a pilot peer support program called Project Wingman that we're going to hear about today at American Airlines in 2011. This program has been modeled by other airlines throughout the industry. He is also a licensed professional counselor in the state of Texas, has been married for over 36 years and proudly has 6 children and now 7 grandchildren. So very excited to have Charlie with us. This webinar is brought to you through our Workplace Suicide Prevention National Guidelines, which are supported by 2 organizations, the American Foundation for Suicide Prevention and the United Suicide Survivors. Our national guidelines are framed on 8 guiding principles. These guiding principles not only define our values, but help to give us a pathway to understand action, policies, and programming. We further differentiate our guidelines and map them into 3 layers of 9 practices. These practices include upstream or preventative work, midstream, early identification, and our downstream or crisis intervention work. Today's presentation on pilot peer support is actually going to touch on all 3 levels of these leading practices. And I will go ahead and turn this over to our guest speaker. Thank you, Charlie.
One of the first things people ask us about flying is, how do planes fly? So I always show this slide to them or talk about this. The bottom line, airplanes, it just flies on magic, as you can see by this slide. So without explaining all the Bernoulli principles, that's how we do it. Next slide. The objectives today will be understanding pilot personality profiles, some of the barriers seeking help, and peer support interventions and suicide prevention. So it's not known to what extent how barriers and help seeking create potential for self-harm in the commercial airline group. That's part of my thesis at a dissertation. So this is kind of interesting, and it makes sense too if you kind of look at these pictures. When people first become a pilot, especially male pilots, on the left-hand side, that's how we see ourselves. After a few years in the right seat, the first officer, you start looking like that. And as a captain and crusty, you look like that. And at the end, when you become an instructor, that's an actual view of a pilot. The next slide shows what we really do think about ourselves. That's us. That's no matter whether you're 22 or 72, that's how we see ourselves. And the next few slides will show you a little bit more about our personalities. In 2004, NASA conducted a big study using NEO-PIR. They used 93 commercial airline pilots, mostly male, 23 to 65 years old, from 14 different airlines, and they measured individual pilot personalities in the 5-factor model. And here's what they found. Well, not surprisingly, neuroticism was pretty low among the pilot group. Hence, you don't want somebody sitting up front who's pretty neurotic. So pretty low in neuroticism. Very few were in a high range. So next slide shows extroverted. Well, no surprise there, pilots are typically extroverted. And for those of you who've seen the Top Gun movie recently, we like a good time, and we like outgoing people, and we like pushing it up faster and funnier, and like running around afterburner. Next slide. Openness, very interesting. As you're not surprised by this slide, we're not real open. Pilots typically do not want to share their emotions and feelings, especially when it comes to mental health issues. In the words of C.S. Lewis, I'm more comfortable talking about an earache than a heartache. So not very open. Agreeable, not surprising. Nope, we're in charge. We like to do our own thing. We're pretty self-deterministic. We like to fly by the seat of our pants a lot, and we typically like doing our own thing. Conscientiousness, no surprise here though. Even the 5-factor model shows us that, generally speaking, conscientiousness is the #1 factor in success. Pilots are very conscientious, always want to do a very good job, and almost to the point of being perfect. And we'd like to see ourselves in a real summary. We have the right stuff to be doing what we're doing. However, though, here's part of the problem. So what we just talked about, the 5 factors, there could be produce a barrier for us in help seeking. And for many of you, probably not familiar with this, but the FAA requires, Federal Aviation Administration requires airline pilots to go through a medical exam, through an aviation medical examiner every 6 to 12 months, depending on the pilot's age. If you're over 40 years old, you require one every 6 months. So you must complete an official FAA medical application form 8500. Now, why this is important, why this is a barrier, because on this form is like over 40 boxes you must check yes or no. And one of those boxes, box M, is called psychiatric disorder. And in that box subset is called anxiety, depression, other. And that's where most pilots would go to their AME and kind of check no. Now, this is why. Look at this. Dr. Hoffman and did a study in 2019 that demonstrated that over 40% of civilian general aviation, we call them GA, and commercial pilot withheld information from their physician, while almost 60% had delayed or not sought medical care concerning their status as a pilot. Why? Well, the biggest reason, the barriers, fear of losing our medical. Again, the FAA requires those strict physicals, but we don't want to lose our medical. So that box M oftentimes is click no. We're afraid to lose our medical. Fear of job loss. You lose your income, you lose your job, you're out. And so that's why that's a big barrier. And how we can reduce that, that's for discussion another time. And the last barrier is stigma. Many of the pilots I've talked to, we don't seek help. They've said that we don't come to you or see a mental health clinician because we're afraid it's going to look bad. I don't want the stigma imposed by myself and the stigma on the public, my peers. It's a big barrier. So the big 3 barriers are fear of loss of medical, fear of job loss, and stigma, whether it be self or perceived. These are some of the things we felt of the last 10 years that really mitigated some of the barriers. So our peer support intervention, suicide prevention for pilots included this: human factors training. Human factors training is an annual course that each pilot at our airline must go through every 12 months. This includes ground schools, simulator training, and then time for human factors training. It's an hour-and-a-half class that talks about areas concerning safety, accidents that have happened throughout the industry or incidents. And so we learn from all those things. It's a very productive class. Embedded in that class, we finally done this. We put videos and testimonies of suicide intervention with peer support. Now, these are very powerful videos we've done through corporate comm. We've had volunteers who've had issues, mental health struggles, and do a video for us, about a 3 to 4 minute video, and fully edited, professionally done, and to a T. Most of the pilots have come out of that class. I worked in the building. We're just overwhelmed by the authenticity of these videos, and it helped them. I actually asked them, would you be more willing to seek help based on what you just saw? And they said, absolutely, absolutely. And so those videos really, testimonies have really helped us mitigate some of the barriers to mental health seeking. Now, we also have a 24/7 hotline. And the reason why we've done all this, I'm going to back it way up a little bit. In 2011, we had 6 male pilots take their own lives, which is pretty high in our industry. So we decided to make it more accessible. So we designed a 24/7 hotline, train volunteers, and now we totally mitigate with marketing, education. We'll talk more about that in a second. But we actually are starting to really target the new hires. We're hiring over 100 pilots a month off the streets. And so in basic in-doc, we are now getting 5 to 10 minutes to talk about mental health, mental well-being, and access to peer support for the new hires. Many of them come from regional carriers. They're very reluctant to self-disclose because over there, that we've learned, they're more punitive when it comes to self-disclosure. However, in the major airline we're with, that's not the case anymore. So we're talking about suicide prevention. We bring up the suicides that have happened, and then we give them the information on the website specifically for the pilots. And there's lots of information on department flight bulletins about suicide, and we actually brief them on his PathWarm acronym when it comes to suicide prevention. Because many of the pilots, they would ask me, what were the signs, Charlie? What did we miss? And so that's why we put that acronym on the big website, big bold letters, is PathWarm, give a basic understanding of suicide prevention among the pilot peer group. Let me just say this as a moment of, well, we're beating our chest here a little bit. In 2011, we had 6 suicides. And since then, we've reduced our suicides at our major airline among pilot group over 70%. Now, we've caught some people in the net and got them the help they needed, and they're back flying. Actually, 2 pilots right now who are actually were thinking about it, actually talking about it, and a welfare check got them safely to a hospital, and they're actually back flying as of this day. So there's been some lives saved, and because of peer support intervention and suicide prevention. Now, the last thing we put down is crew ID with phone number for peer support. On our lanyards, we have the company ID and a union badge. And we decided after the first bullet point said, in case of accident, call this number. The next one, in case of crisis, please call the Project Women hotline. We see great success with pilots who are both domestic and international. I use that hotline badge. That's a number on the badge. So a lot of interventions going on at the last 10 years. From my experience and some of the research, and I've talked to other airlines, I've lectured over in Europe, I've lectured throughout the country. I was just recently came back from the ASBA conference, Aerospace Science Medical Association in Reno. And some 3 things I think I've come up with the last 10 years. What's the success of peer support intervention and suicide prevention? One of them is that company and union must collaborate, and the data is there. There's 2 studies done, I think one in Toronto and one in London with the police force and with the high suicide rates. And because of this first bullet, I learned when you get the company and the union officials collaborating, supporting mental health pilots, make it apolitical, neutral ground, they've shown success. So at our company, we have a full-time, which would be me, in the flight department embedded to work with also union officials and a pilot who collaborate together to make sure that the pilot or family member is getting the proper resources for the mental health issue undergoing. So the second one is you must educate and train both flight management and union officials on the efficacy of peer support in reducing barriers. That means when you do training cycles of the peer support, having some management be there, chief pilots per se, and union officials there sitting in the audience with the new volunteers and the old volunteers during recurrent training to learn more about what's happening with peer support interventions. And we've been doing that the last 10 years. And I could say to this, that our management team, flight department, is fully on board with mitigating mental health issues for pilots and American Airlines without reprisal and confidential. That's huge. The third thing, the company and union must market and promote and educate pilot well-being as part of safety management system. You all would agree that a mentally fit pilot is a safe pilot. And now we've been doing that, saying if you're fit for duty, when you click that box, when you sign in at the computer website at the terminal, when you're ready to sign for your jet, you must sign by federal law, are you fit for duty? And we've been teaching the pilots, if you are not mentally fit for duty, you should not be at work. If your spouse, your family member is suffering at home and you're distracted, you are not mentally fit for duty. And we have seen great results by pilots reducing that barrier of self-disclosing. I'm not fit for duty. And so market and promote pilot well-being is very important as part of the safety management system at our airline and other airlines per se also. The next slide is the references. You can look at that.
Thank you, Charlie. This was an outstanding overview of the work that you've created and have scaled up and are implementing and now studying in the airline industry. Really great to hear how all the pieces come together in the different levels of intervention, prevention, and early intervention and post-prevention. So thank you for that excellent presentation. Thank you everyone who joined us today to learn more about the programming that's happening in the flight industry. We hope that you all will take action with suicide prevention in the workplace. You can go to www.workplacesuicideprevention.com and take the pledge. You can register and pledge to make suicide prevention a part of your health and safety initiative at your workplace and or professional organization. And let us know what you're doing. We'd love to hear from you. So thank you again, Charlie, and thanks to everyone who's watching. Take care.